It's 2023 and there's still a lot of misinformation out there about chiropractic. So I'm going to start debunking all of the myths, starting with the most popular, that chiropractors are not real doctors. So I guess it depends on what your definition of a doctor is. If that means just only prescribing medication, then you're correct. I'm a fake doctor. I'm just joking. Chiropractors don't prescribe medication, not because we are inferior to medical doctors. It's because that's just not what we do. Our method of treatment is our hands, so it's manual therapy. So we are just different. You would go to a psychologist for therapy, for example, but you would go to a psychiatrist if you needed medication. There's also a huge discrepancy in what people think that chiropractic education or training is like. Contrary to what people believe, we do not go to witch doctor school. Believe it or not, chiropractic and medical students go through very similar trainings. First of all, for entrance, it's more or less the same prerequisites as med school. I do have a bachelor's degree. And chiropractic school is an additional 4 to 5 years depending on the school that you go to. You would also be surprised to see that the actual curriculum in chiropractic and medical school is very similar. People are actually very surprised that chiropractic students actually get more hours than med students, specifically in the areas of anatomy, physiology, orthopedics, x-rays, and even diagnosis. The reason why we have so much diagnosis is because as chiropractors, we have portal of entry status. This means that we have to have the ability to diagnose anything. And if chiropractic can't take care of it, then we need to refer you to the correct physician. For example, internal conditions such as shingles or an abdominal aneurysm that can actually manifest as physical pain. I think you can notice the big difference where we lack is psychology, psychiatry, as well as gynecology. And that's just because that's not what we do. And the last big difference between chiropractic and med students that people tend to argue about is that med students go through several years of a residency program. The reason for this is as a chiropractic student, you graduate already a specialist in your field. Med students, on the other hand, they need to figure out which particular area of medicine they're going to practice. When I was a student, I had a 1-year internship where I got hands-on clinical experience. And lastly, to become a licensed chiropractor in the United States and even Puerto Rico, you have to go through a 4-part rigorous examination by the MBCE.